10 ways to be a champion in managing infections in surgery. First, follow guidelines and clinical pathways. Both international and local guidelines can guide clinicians in the prevention of healthcare-associated infections and the management of infections when they occur. Second, enhance infection prevention and control. The application of appropriate infection prevention and control strategies can reduce the risk of healthcare-associated infections, as most of them are preventable. Third, control the source of infection. The source of infection should always be identified and controlled as soon as possible. Failure of antibiotic therapy in patients having continued evidence of active infection may require reoperation for a second source control intervention. Fourth, prescribe antibiotics only when they are truly required. Antibiotic prophylaxis should be administered for operative procedures that have high risks for surgical site infections or when foreign materials are implanted. Antibiotic empiric therapy should be initiated after a treatable surgical infection has been recognized. Fifth, prescribe appropriate antibiotics with adequate dosages. Antibiotics dose should be optimized to ensure that PK/PD targets are achieved. This involves prescribing of an adequate dose according to the most appropriate and right method and schedule to maximize the probability of target attainment. Sixth, reassess treatment when culture results are available. The appropriateness for the antibiotic treatment should be reassessed when culture results are available. Seventh, use the shortest duration of antibiotics based on evidence. Once source control is established, short courses of antibiotic therapy are as effective as longer courses. 8. Educate staff how to prevent healthcare-associated infections and how to use antibiotics wisely when they are required. A range of factors such as diagnostic uncertainty, fear of clinical failure, time pressure, or organizational context can complicate prescribing decisions. However, due to cognitive dissonance, recognizing that an action is necessary but not implementing it, changing prescribing behavior is extremely challenging. Ninth, support surveillance of antimicrobial resistance and monitoring of antibiotic consumption. Monitoring of antibiotic consumption and surveillance of antimicrobial resistance should be supported and implemented. 10th, be aware of your role and responsibility for maintaining the effectiveness of current and future antibiotics. Follow locally developed antibiotic guidelines and clinical pathways. Enhance infection prevention and control. Control the source of infection. Prescribe antibiotics only when they are truly required. Prescribe appropriate antibiotics with adequate dosages. Reassess treatment when culture results are available. Use the shortest duration of antibiotics based on evidence. Educate staff. Support surveillance of antimicrobial resistance and monitoring of antibiotic consumption. Be aware of your role. Together we can impact millions of people. Thank you for the attention.